You all know it's a Wednesday, so basically every single Wednesday I get to have someone special in the building. And well, today I'm having a clinical psychologist. She's called Barbara Mugambe. Hope I pronounced it right.
Kinda. Barbara Mugambe. Let me start with Barbara Mugambe.
Well, she's in the building, ladies and gentlemen. We're going to talk about everything mental health, wellness. And I love the fact that she told me this morning as we were struggling with our jam and rain, she was in the gym. Hey, how'd you do it?
Corey, I'm telling you, you need to start investing in yourself now.
Hey.
It's a mindset. You know, when you start your morning with a workout, the rest of the day is set.
Ooh.
It's truly set. Your mind, your wiring, your neurons are set to help you.
So come rain, come shine.
It has to be. If you had the plan at night, what's a little rain and traffic jam, yeah?
A little rain? Honey, people have drowned.
I heard.
It was a tough one.
It was a tough one.
People were actually calling for public holiday.
Just know, I passed by industrial area and I was like, what is going on?
Yes.
And I didn't get it. I drove back. I went all the way around. And when I reached the gym, it's when people say, things, and I was like, oh my God. You know, every day we wake up, we plan.
Yes.
God has already planned.
Yeah, God's plan's different.
Yeah, but we thank God, that we're here and we're praying for those that have been lost.
Well, I'm happy to have you here, honey. I'm super duper happy. So let's dive straight into your journey of psychology. You know, what inspired you to become a clinical psychologist, and what has your 8-year journey in mental health support been like?
So now, Corey, let me tell you the funniest thing about anything. Okay, most people that I talk to in psychology, even when you do the masters and, you're continuing to do a PhD, most of us start out because we want to understand our own minds. We're struggling with we have our own mental struggles, and you're like, how can I figure this out by myself without going for therapy, but I can do it for myself. And then once you start seeing the light, it's helping you. You're understanding the mind more. You're understanding your body more. You're understanding everything way more. You're like, okay, let me continue. Let me help people. Yes. And then you start noticing that there's some things people are struggling with silently. Like, let me actually even talk about this. We have this thing called pop psychology, yeah?
Yes.
Where the self-help books, all those things. And it's easy enough for someone to say that one is this because they have read about it. But then as you do clinical psychology and you understand it, you understand that there's more to that person than what you are labeling them as. So helping people in communities, I've done work for refugee centers, people who have been in war, trauma patients. I have gone through organizations. I am helping children, adolescents, those are beautiful to work with, and I really love working with children. And then also adults, because as adults, there's something they say that adults, we are adults, but we are 4-year-olds in our heads. So it's just a beautiful journey there's been for me to help someone realize all these things and then coming out of them. As in seeing the resilience of my clients, and someone comes back and they're like, what I was last month,
it's
that's
not
me.
Yeah,
I'm quite better, and that gives me so much joy because it helped me as well. And I also had high blood pressure when I gave birth to my first baby. I was very big, and I was like, oh my God, how am I going to help myself? Because anything would strike it. You piss me off a little bit. I'm like, it goes up. So it helped me. Psychology helped me reduce all these things. So that's why I kept pushing. To
a layman language, someone could be saying, what is psychology exactly? And how can, what does a clinical psychologist really do? Let's just break it down, because I know that people listening in, they're like, now what does that doctor do?
Wow.
What does that person do exactly?
I'll get a PhD and I get that.
Okay.
But, psychology is all about the study of the mind, understanding how the mind is interconnected with the body and everything else. So now, because remember, we are in psychology, we look at our thoughts. Our thoughts create our feelings, and our feelings are going to create our behavior. So this is what we look at. So we have different variations in psychology. We have counseling psychology, we have clinical psychology, we have health psychology, it's really, really big, and we break it down. But in clinical psychology, I actually do a diagnosis. When someone comes to me, we have to go through a questionnaire. We go through an interview. We do assessments. And then I diagnose you with something that you have. So with clinical psychology, you're coming into for psychotherapy, which is usually talk therapy, movement, and everything. When you're coming in, it's a long-term investment. I'm not going to work on what you're dealing with right now. I will look for what is causing you to be the way you are. And then we work through that. And then when you're looking at counseling psychology, counseling will look at it's like a short-term relief.
Well, now I do understand, and I believe somebody else has also done. Now, the power of therapy. Now, many people will, hesitate to seek therapy. And many people think that for us to see a psychologist, I would rather go speak to my auntie, to my mom, to my barber, be at a saloon and gossip or something. It's something that people really put out there. So how do you create, a self and non-judgmental space for a client to open up? Because I know it's very hard. Some people have to drink a few here and there for them to be open to speak. So how do you handle?
So first of all, it comes off with a misconception of what opening up is, because people have fear, a huge, huge fear of someone getting to know them. But in my space as a clinical psychologist, we are taught, and as in we are even recommended, you need to have your own therapist so that you don't transfer whatever is happening in your life to your client. So we give you a non-judgmental free space. As in, even when we are writing down, like my notes, I won't write your name. I'll use some initials of, you don't exist, but you are my client. So we'll have empathy. I will see your situation as it is and validate your feelings. The validation is so true. And I listen, completely listen. Because you go to your auntie, Koja, because those things have been there, and people used to use them, You go and they're like, but Kojas, can you be strong? Be strong, Why? What's happening? Your aunties, we're in different generations. Completely different generations. What you're dealing with now, your auntie, like, I keep telling my parents, post-COVID, even then they did not know what happened in that era. But now post-COVID, what is happening? Our mental health was really, really, really disorganized in that time. Even our parents are wondering, how are you guys managing to actually deal with life? So now also generations are different. So I have studied, I have empathy, I validate, I listen. So that's where I tell people they shouldn't fear. They need to open up. It's okay to open up. It's okay to be vulnerable. People want to, there's the one thing, females who are hyper independent. Also, that's like a trauma response. So I also deal with trauma therapy. Because why are you being hyper independent? It's okay to be vulnerable. It's okay to come and say, you know what, this has actually failed. I would need some help. It's okay to ask for help. It really is. And help whereby you might not even ever see me. You can do our 12 sessions and you might not ever see me again. But you came and you unpacked whatever was happening to you there. And the beauty is you always get better. You really do get better.
Well, many people do not know that, but it's okay not to be okay. But understanding mental health in Uganda, from your experience, what are some of the most common mental health challenges that Ugandans go through? Like, I know you have a client list. They come over and over. The line is long. But what are some of those that, you can point out and say, at least most of the Ugandans have this that they face?
Well, the usuals that will never go by fingers: depression, anxiety. Now we have an increase in suicide in Uganda, whereby people are sitting and dealing with their problems and they're piling and piling them. So the only way they look at it, let me take my life. But then again, anxiety can get so bad. People do get panic disorders. And then when you get a panic disorder or a panic attack, you would rather end your life because the panic attack really takes a toll on you.
Yes.
So then we have burnout, then we have stress, then we have the beautiful one, addiction. Yeah. We have people who... Ugandans love their alcohol. It's okay.
So much.
As in really.
Yeah.
I won't even say that I don't, because I also do indulge once in a while.
Yes.
But then, for every problem, a Ugandan would rather cover it up with alcohol. For every problem, now we're looking at a high increase in drugs.
Yeah.
So those are the new things that we have. Even when we're in Butabika, our ADU unit is quite full. But it's so anyone who comes in and understands that they need help, because anyone with addiction, they need to first understand that they need to change to get help. If they don't understand that, they never get help. But those are the major ones that I can see. But then we have the others that we do assessments for. The ones bipolar disorder. Bipolar disorder is major. It's around, and
people do not know.
People do not know. They're there. And you know, the thing is, because we do not want to go and invest in ourselves to understand what is going on with us.
Yeah,
that's the thing. We really do not. You can be, because if I give you like now, someone who's bipolar can be hyper for 7 days.
What?
And then they're depressed for the rest of the time. Yeah. And we just think someone is happy like that. But no, there's an underlying condition.
Yes.
And the wiring in the brain is not quite the same like yours.
Yeah.
Because you can, if you don't have it by now, then you will never get it. But then there are those who grow up with it. People with ADHD. We have people really with ADHD, and people just keep... Well, when they come in, we can always diagnose.
Well, I wish we would extend this entire hour, because there's just so much to talk about.
Yeah.
But let's talk about the burnout and stress.
Yeah.
Right now in workplaces, I could say that like one of the major triggers that most work individuals are going through. At least I know there's someone who sits there and say, okay, it's just adulthood. Like I have nothing to do, but yes, the stress is there. So let's talk to the bosses for a minute.
Yeah.
You know, what could be your best advice and tips to bosses to help employees with the burnout and stress in work environment?
One thing that comes to mind, I do workplace mental health as well.
Oh, nice.
They need to give their workers where they can pour it out, because they're not going to pour it out to their bosses one or the other. You know, whatever is frustrating, you're not going to tell your boss.
Yes.
They need to have an outlet, which one or the other, they need to have a counselor, they need to have a psychologist at work. You know, tell them to get that time to go and do that. And then the other things, they're the major ones. Holistic well-being for the workers, you know. Imagine sitting the whole day. There's no going out for a walk, there's no doing anything. They need to do a bit of walks, get out into the sunshine, and then flexible working hours.
Yes.
That has to be really in 2025.
Like today, honestly, yeah?
Yes,
the rains. So many people could not make it.
But you know, it's only in Uganda. Ugandans,
but then you get the boss seated waiting for you.
Exactly, for them they're here already.
They drove.
But you know, with burnout and stress, it comes. There's so much you need to do for someone not to have that. Because remember, someone is not only stressed at work, they come from home with something else, and then work adds on it. So it keeps piling and piling. And then again, you need to understand that there's good stress. Stress that pushes you to do.
Good stress?
Yes, stress that pushes you.
Good stress?
Like, you know, it's adulting. Yes, I need to be at work at this time. That's good stress. That's good stress. Okay. That's workable stress. But this stress whereby, oh my God, I cannot sleep, as in you need to be at work at 7, then you leave at 9 p.m. The hours do not really work with your own well-being. And then you need to, when you reach home, also your wife is saying, but boss, you are not at work, you're lying. And then there's also that, then you decide, you know what, I'm going to go have a kabia. Kabia ends at 1 a.m. Then you have to be at work at 7 a.m. As in, you see. So all those things, we need to... Workplaces need to have a place where they have mental health workshops, making them understand how they can help themselves, mindfulness techniques, those ones of grounding. There's so much to learn, and there's so much for me to teach. That's what I can say.
That's what I'm saying. They should give us more hours. Yeah. But anyway, look into red flags in mental health. Now, sometimes people struggle silently. Yeah. Like, it's really hard for you to know. But some, there could be some warning signs that I believe probably people should know. What are some of those that at least, I should identify? And probably I see, I'm like, Julius is not this. Or maybe I'm saying, I always see Didan like this, but then today it's this and this. What are some of those red flags or those signs that we should see, among our friends and family members?
So, big example. I've been listening to Didan for a while.
Yes.
She's a jolly person.
Yeah.
She's loud.
Yeah.
She's, when Didan is in the room lights up.
Yes.
So now Didan comes into the room dims out. You don't even notice Didan is there.
Yeah.
Didan doesn't want to eat.
Okay.
Didan loses weight or gains weight. People think that when someone is going through a mental health challenge, they just lose weight. No, you can just decide to just be eating all the time and gain weight. They're not sleeping like they used to, or they are oversleeping. So those are mainly the things that will go through, like depression, anxiety. They can't stay in one place. When they stay here, they're like, oh my God, no, I can't be there. They're moving around. You're like, but what is happening? What is wrong? Then, people, the thing is, as human beings, naturally what I've learned, someone will always tell you what is wrong, but cover it up with something else.
Yeah.
They can say, but life can be a bit trickier. Then they stop. Then they're like, what do you mean? They're like, nothing. Then they're like, but hey, you guys, that game. Then they move on and they just change the words. But people always do say, you always need, just because we're not listening. But if we are listening, you can always tell when something is going wrong with someone. And then you're looking at them, they're not even taking care of them, as in hygiene is poor. Because, really, if life is not going on for you, why should I put on lip gloss? Why should I do my hair? Why should I even dress nice? Just go, get on with the day, get done, and move back home and sleep. They're not interacting as much as they used to interact before. They would rather not be in spaces. The spaces they used to love. They don't do physicals anymore. Because, there are people who don't do physicals, but then they try to do, you see them around. But then now they're not around anymore. So those are just some of the little bitsy things you can see around your friends.
Even start drinking too much.
There's that. Or they start using another drug. Let's say that. They just start using another drug, because alcohol has been here for the longest,
Yeah.
But the new drugs that we have, that, if someone is going out way longer than they used to, they're coming in late, they're coming in drunk, they're coming in all those things. They just keep piling and piling. They're not productive at work.
Yes.
Someone you knew that was very productive at work is doing 30% of what they used to do.
Yeah.
That's when you can notice. And it's so simple. It's always just asking, are you okay? But even someone who's smiling a lot can tell you I'm okay, but the probing will also help you understand that they're actually not okay, because life is hard. Life can really be hard. And, and the life we're living in, people can be a bit too judgmental.
Oh, yes. People very judgmental. And that's why people are silent.
Yeah, people prefer being... That's why we are here, the psychologists.
Yes.
Come, I'm your safe space. Come, I won't judge you. Come, I will validate what you are feeling. Come, I will listen. That is what I am... That is what I'm trained for. As in, for me, it's like putting on a glove.
Yeah.
It's so easy. As in, by the time you leave the session, you must be smiling. When you come in sad, at least you leave smiling, because then you see that, okay, something can happen. Something can change. Yeah.
Well, I love the way you say, I am here to listen. Come to me. Well, did you reach some time or some part of you where you're like, oh my God, I have had over 20 patients today. Like me, myself, I'm draining.
Okay.
Did you reach a point point where you also want therapy from another therapist?
As I told you, when we are doing all of this, you need your own therapist. You need to have someone you're going to dump on.
Okay.
You know, because we also have our own lives going on. You get it. Like, you have, like, I'm married, I have kids, I have to cater to that,
Yes.
But then you also have to be present for because for me, I'm very passionate about my work.
Yes.
For me, it's always purpose and passion. I'm very passionate. When I get a client, I want to be full in.
Yeah.
So when I start feeling like, oh my God, when they're telling me something and I'm like, oh my God, even that you feel like it's something wrong, then I know, oh my God, I call my therapist right away and I'm like, we need a session because I think a counter-transference, as in there's something going on. I'm not being empathetic like I want to be.
Yes.
So then they'll say, okay, let's break it down for you. And also they have somewhere they go where they have to break it down. Exactly. Okay. It's an entire cycle.
Now, this makes a lot of sense because sometimes I feel like you have to sit with someone's secrets. You know, don't they drain you? But anyway, I love the way you've said it. You've explained it perfectly well. You also have to carry it and dump it somewhere. But have you reached a point where you have, let's say, a patient who gets overly attached and obsessed with you? You know, have you got any scenarios you could share?
Okay. Wow. Yes, there's some because. And then this goes into attachment styles. Oh, yes,
because you're listening to them.
Exactly, and you're validating, and they're like, oh my God, maybe this person, you know, they jump from the bound. Because one thing is, I always put a boundary.
Yes.
One thing in life that I keep telling my patients, you need healthy boundaries.
Yes.
So what you're here for is, you're a patient, I'm your therapist. That's where it stops. So when they become too... Oh my God.
Clingy and all that.
I've been calling me by 6 p.m. It's done. No more. So when I see 9 p.m. Why you calling? No. Yes. Boundary. So when you are jumping the boundary, then you'll be transferred to someone else.
Okay.
And that I make it clear. So if you do not want to lose that, you have to keep the boundary.
Okay.
You have to completely keep the boundary.
Well, ladies and gentlemen, if you've just joined the conversation, we're on the lunch date with Barbara Mugambe.
Oh.
And well, she's a clinical psychologist. And of course, therapy is what every Ugandan needs right now. Of course, I'll be giving you a few contacts on how you can reach her later on. But let's go ahead and take a quick break. We'll be right back. It's 88.2 Sanyu FM. You're still on the lunch date with Corey, and joining me today is a psychologist. She's called Barbara Mugambe. I pronounced it perfectly well, so I've learned the name. And by the way, I was already having my therapy session. For your information, just a tiny little break. Barbara was already helping me, and I've got to realize, oh my God. So we thought that therapists are just too expensive, but man, there's so much that they actually, dive in. Like, just imagine someone listening to your problems back to back. Barbara.
1 hour.
One whole hour.
Yeah. You just talk. I'm here to listen. I'm here to validate you.
Yes.
As in, you're in a safe space. Whatever you say, whatever you say is going to stay there.
Yeah.
Nicely. You know how there's always this joke of like, oh my God, I told my therapist all these things and now I'm meeting them in the bar. Even in the bar, there's no judgment. It's like, cheers, you're good. As in, I don't know you, you don't know me, let's move on. That's how safe we are. It's really a safe space. So,
wow.
Yeah.
Well, I love the way you say safe space. So I think everybody listening in right now definitely wants to be in your safe space. But I'll let you share your contacts later on. But so many people choose social media as their safe space. What's your take on this? Because some people think that if I go and I post things to strangers or people who don't really know me, probably they could help me out. That's why you hear someone record a video, or you see some videos making rounds where someone is crying on what they're going through and stuff like that. Do you think social media can really help people, with mental health, or people who are going through a meltdown in life?
So I think I'm actually doing my thesis on social media, but anyway.
Okay.
Social media, for me, what I'd understand when someone is crying out, and it's like looking for that validation. Yeah, you're seeking for that validation, and you're looking for people to listen. So usually with social media, you're going to get like a group. You get people are going to come in the group, and everyone's going to come with their perspective, and everyone's going to come with their, oh my God, and it's like people backing you up. It's way easier. It's like group therapy, but really not group therapy because you're not meeting each other, but you are validating each other's problems, and then it helps someone feel, you know what, I'm not actually on my own. People are actually going through the same thing that I'm going through. So they would rather go vent it out on social media. But the problem with social media, again, when you're venting out, there are also people who are going to do this constructive criticism as well. And in that time, you're not going to need that constructive criticism. So usually it also takes it in the wrong way. So you might feel good about it for a minute, but then usually it will make you feel bad in the long run.
Well, is it true that people who post pictures are usually looking for, validity on social media? Someone told me mostly this is for on a meltdown. So they just post because they want you to say you're beautiful. They don't believe it, but they want to hear it from a crowd of individuals, of strangers.
There's some people who just want... I'm open-minded, by the way. I'm very open-minded. I think when you're a psychologist, you really have to be open-minded because if you're not... what people come in with, you'll be shocked. But people post pictures because they're looking for people who are like them. You're like me. Let's, come through. Let's share this. Let's share that. There's some people who start it off like with looking for validation. Then it ends up being something, because anyone looking for validation sooner or later falls off. But then also there's also this entire thing of people posting on social media a life they're not actually living, because that's the validation they're looking for, to make people understand that, do you know who I am? This is who I am. See who I am. And then the more they post on social media, something like that, and people believe, this is where social comparisons come in, which also bring a lot of depression and anxiety, because someone can say, oh my God, how can my friend who's 30 be with all these things, and then yet I don't have this. So then it brings depression, it brings anxiety, it brings eating disorders, it brings so many things. But then social media is meant to be something for fun. Really, social media is meant to be something for fun. Right now, though, social media has like, as you say, pop psychology, self-help books, all the things, videos on TikTok that can help you with psychology and understanding it in the smallest bit that they can help you understand it in. But it's meant to be fun. You're supposed to enjoy yourself on social media, not the bullying comes in. Remember there's cyberbullying, and most of our teenagers right now are facing a lot of cyberbullying because as parents, we get in the phones and we're like, you know what, I'm working, have the phone, you deal with that, I'll deal with you later. But then there's a lot of cyberbullying, and it takes a negative toll on people, because we as we're growing up, we have psychological empowerment. You have your meaning, you have your, your competence, you're understanding who you are growing. So the more you share on social media and someone says, oh my God, that's not you, no, you start growing into antisocial behaviors, you start doubting yourself, you start taking back your values of, people are not understanding what you want, the message you want to bring out. So social media has its pros and cons, really. It really does. But then I feel like the cons are way more now than the pros. So, there's a lot of research going on this, evidence-based. It's doom scrolling. If you take so much time on social media, it really just
finishes you.
Yes, it really does.
And well, looking through, you talked about group therapy and individual. Can you give us a few benefits of and which one would one rather? Because some people are very okay to speak up when they are alone, and the others will only speak when others are also speaking.
So you see, individual therapy, this is now like a one-on-one.
Yes.
And this is going to your deep inner dark secrets. And we all have those deep inner dark secrets. Something you don't want anyone else to know.
Yes.
It can be your deep trauma, something that you want to share alone with someone. And then usually with individual therapy, it can, like in addiction, for example, it can start with individual therapy, because someone who's addicted in a family is not the problem. That's just a symptom of the problem.
Okay.
Yeah. So it starts off with that individual, then we go into the family therapy. So we go it in the group. And then now when you're going to group therapy, this one looks at like grief counseling. Yeah?
Yes.
It's beautiful to know that you're grieving with someone. You're sharing stories with someone. Someone is understanding you in that space. Yeah. So group therapy also has its benefits. You're in like-minded people going through the same situation. AA, alcohol addiction. So when you're talking and you're like, oh my God, I was so drunk, I don't remember driving this. Relating with someone who understands you in a group is way easier than the individual.
Well, I could say I would really love. I think being among many people, I would rather have a group.
You'd rather have a group, yeah?
Individual, I'd still be shy. I'll be like, oh my God, how's she going to look at that? Right?
Trust me, by the time we're done with the first session, because for me, my first sessions are always free.
Yes.
So I'm building rapport, which rapport means I'm seeing our chemistry. So if by the first session you are not comfortable enough to say, Barbara, I'll be back, then that means we can never work. So usually the first session is where we take away all this tightness in the body. We take away all that, oh my God, she's going to judge me. Oh my God, she's going to think I'm so, and what I keep on telling people, whatever they're going through, whoever they think they are, whatever is happening, it's not their fault. Because someone can wear this huge thing of, oh my God, it's my fault, it's my fault. It's not your fault. There are things that happen to you that actually made you the way you are. And when we unpack it, then you get to evolve and become a better person of who you want to be.
Barbara, I could listen to you over and over again. Write a book. Have you written a book?
I want to write a book.
Please do. A podcast? Are you planning for that?
So I'm planning to start a YouTube channel.
Oh, please do, honey. Because I just love listening to you. But anyway, I'm looking through any advice of mental health for the listeners, because I know so many right now are struggling with anxiety, stress, and so many challenges. Uganda is a tough place. Visitation is ongoing in schools. Parents don't know where the money is. Just a few days to the end of the month. Someone doesn't know how they're going to survive to the next payday. What could be your best advice?
Start small. Really, as we like taking on big. Yes, we need the big, but start small. Like when you feel the anxiety coming on, take a walk. We have nature. We really have green in Uganda. There's no house you go, like there's always a garden, there's always grass, there's always something. Just take a walk to be outside to refresh your mind, because that's the one thing you need to start with, grounding yourself in whatever is happening. And then when anxiety is building on depression, because with depression they also say depression hates movement. Because you sit down in one place, oh my God, and you will get up and say, you know what, today I'm going to go for Barbara's spin class.
Let's talk about the spin class. Let's talk about the spin class. So where do you always have the spin class?
I do my spin class at Speak Apartments, Monday 12:30 to 1:30. It's a beginner's class, very friendly, groovy. We talk to each other and, just get a sweat, because we need that I was telling you, dopamine.
Yes.
The pain side, So when we put the pain side higher, the reward comes on less and with so much joy. So you need movement. You need to have, we need to have support, whatever your support looks like. I don't know. And genuine support. Really genuine support. Not just, okay, all right, I'm going to sit and, in just a group. And then it needs to be someone who's going to validate you and listen to you. There's a time when you're talking to people and they're talking over you. You need to be with someone and they listen to your problem. And even though they don't offer advice, because I feel like most people are looking for advice. Sometimes someone just wants to just put it out there, don't say anything back, but just be present, which is beautiful. And one other thing is, we have this sense of urgency, but what is happening? We need to take time to breathe.
Okay.
To understand, like, let me take it down a notch a bit.
Yes.
Everything will happen. Everything will unfold like it's meant to unfold. Like,
there's a way God has a plan.
Exactly.
God has a plan.
He really does.
Well, we're going to play this quick game. I usually do it just like for a minute or two, and then you'd finally give us your final remarks and where we can find you. Just tell me what comes straight to your mind. Just a quick one answer. Now, which TV show or movie do you think portrays therapy in the most realistic way?
Most realistic way? Oh my God.
We pass?
Pass.
If you could recommend one life-changing book on mental health, what could it be? One book? What? We pass?
Being Supernatural, the Let Them Theory.
Oh,
I'm good.
Nice. If you could take a wellness retreat anywhere in the world, where could you go?
Cyprus.
Woo! Okay. If you were not a psychologist, what would you be doing? Away from that.
Teaching.
Oh, okay. And then one word to describe mental health. One word.
Peace.
Morning are you a morning or night person?
Morning.
Oh, okay. Coffee or tea?
Coffee all the way.
The best way to distress yourself?
Boxing class.
Oh, boxing? Girl, I didn't see that coming. Okay, one quote you live by.
If it's meant to be, it will be.
Nice. Well, give us your final remarks. Where can we come for therapy, Barbara? Where can we find you? Are you on social media? Do you have a number you can give us? If someone wants to have a more conversation with you, like I said I want, what do we do? Where do we go?
So I am on Serene Minds. I work with Serene Minds. We're a group of therapists there. We're virtual. You can find me there. I have my own company, Iman Wellness and Lifestyle. So you can always send me an email. You can call me up. And
what
you can always.
Email?
The email is imanwellness.lifestyle@gmail.com.
Okay.
Then my phone number is 0745 456 885.
Again.
0745 456 885.
Social media?
Social media, you can find me on Instagram, on Twitter, which is X. X, I'm Barbara Mugambe. And then on Instagram, I'm imanwellness.lifestyle. Barbara Mugambe as well, Mrs. B.
Well, ladies and gentlemen, that was Barbara for you. We've had a chit-chat about everything when it comes to mental health. And for those who are saying, what does a therapist, a psychologist do? Now you understand. And that means you need them. Every adult at least needs a place where they can go and pour, right?
Yeah, they do.
So go ahead and pour it to Barbara. She says she can take it all. She's the safest space you can have a conversation. Well, that brings the end. Have an awesome one. We're out.